My name is Rachel Watson and I'm an Admiral nurse working in the Dementia at Work team. We work with organisations and businesses to help raise awareness of dementia and encourage organisations to help develop a dementia-inclusive workplace. Here's Phil's experience.
My initial diagnosis was one of mild cognitive impairment, and at the time I was a manager at the university. So I had 20 members of staff and I felt quite embarrassed. When I told my employer, was absolutely fine. My line manager, very, very supportive. A year later, I got the further diagnosis of Lewy body dementia, and that was different. When I told a representative of the organisation that I had Lewy body dementia, their very first comment was, right, we need to start the process for you leaving the organisation. I wasn't ready to retire. Luckily, the organisation that I worked for has an independent occupational health service. So between my occupational health consultant and my line manager, I was able to keep working for 2 years post-diagnosis. My employer went through a change, and I went from my existing very supportive line manager to a line manager who wasn't less supportive necessarily, but was less aware. Certainly had no understanding at all of dementia in any format. How are employers and HR going to support people? Because they're still a valuable asset. We are still a valuable asset.
The work we do with organisations involves awareness raising, it involves training and development, but it also involves direct work with human resources teams to help them be aware of policy guidance, of strategies that they can develop for their staff groups, so that everybody who is affected by dementia can receive as much support as possible. Here's Rosie's experience.
I was the main carer and lasting power of attorney for my mum, Dawnie. Dawnie was diagnosed with young onset Alzheimer's disease at the age of 58. I was working in the Royal Air Force as a human resources officer. So I was away all week and then back at the weekends. She was really struggling with a lot of things and needed a lot more support. So I genuinely thought that I was going to have to leave my job. I could not see a way to maintain a career alongside the caring responsibilities that I was increasingly having to take on. And I was really frightened to tell my line manager to start with, but I was really surprised how supportive he was. I was allowed to adopt flexible working, and I can honestly say every single appointment that I needed to be at to support my mum with, I was there. The skills that you develop as a carer are just unbelievable. It's a range of skills you didn't know you needed to develop. You probably didn't think you wanted to develop, but actually the benefit to employer can be huge.
We've developed a Dementia at Work guide that contains valuable insights and practical advice to help you, the employer, create a dementia-inclusive environment in your workplace. To find out more and to download the guide, visit the Dementia UK website.